here at the conference gathered on unceded indigenous lands. The Ganigi-Haga Nation is recognized as the custodians of these lands. So I come from the county of Simcoe in Ontario, and one of the things that we do when we do the land acknowledgement is we just do a bit of a reflection. I would say when I see all the data people that attend these sessions, the thing that I'm reminded of when I speak about the indigenous peoples that occupy the lands is the fact that we have so much power as data people to interpret the data and use and manipulate the data. And oftentimes people don't even realize what we do behind the scenes. And so when I hear from different indigenous leaders, it's interesting to remind myself that we have such an important role in everything we do, and to make sure that we are doing everything we can to support these individuals. So we have some great presentations lined up for you today. There's 3 presentations. So we're going to start off with a presentation from End Homelessness St. John's on accurately collecting and recording disability data, followed by Calgary Homeless Foundation on their coordinated entry tool. And then finally, Services and Housing in the Province, or SHIP, is going to talk about data justice. So then afterwards, we will have some time for a brief Q&A session. I hope everything works out well for everyone. So without further ado, I'll hand over to these guys, our first presentation by End Homelessness St. John's.
Okay, hello everyone. My name is Anissa Neal, and my colleague here is Chris Cumby, and we will be talking to you about how we started recording and kind of accurately collecting disability data in our community. So we are currently located in St. John's, Newfoundland and Labrador. I would just like to give a specific little land acknowledgement to where we're coming from that will be reading from our Indigenous partners at First Light. They also have a living land acknowledgement that they recently released, so I highly encourage you all to check that out after the presentation. St. John's is home to a rich, diverse, and vibrant urban Indigenous community located on the ancestral and unceded territory of the Beothuk. The lands and waters in and around the city have traditionally served as a gathering place for the Mi'kmaq. The broader region of Newfoundland and Labrador continues to be home to diverse Indigenous peoples, including First Nations, Inuit, and Métis. We honor and pay respects to the past, present, and future caretakers of these territories. So what I have on screen right here is just a little roadmap of what we're going to be talking about today. We're going to start with kind of the question and background that really shaped this project that we embarked on. We'll move on to the methodology to look at how, with that question, decided, the background research, how we started drafting the way to actually start asking this question, and then we'll close with some results, some preliminary results, show you what we have so far, and I'll talk a little bit about a resource I have that is ready to share with you all in terms of how to kind of take some of these tools back to your community if you are a HIFIS using community and get started on collecting some disability data. I will now hand it over to Chris.
Thank you very much, Anissa. I appreciate it. Hey, folks. So first, I should probably say, ask the right question the right way. It's a bit of a misdirect because there is no right or perfect way to ask any question. Instead, there is an intentional way. So what we have to ask ourselves is, what are we intending and how do we intend to try to reach it? Our job is then to try to capture this as accurately as possible. So that's kind of where we're starting from. So with this process, I'll go into it a little bit more, but first I want to define what is disability. Because if you ask 100 people what disability is, you're going to have 100 different answers. So when I was digging into this more for this presentation, I started off with the federal government of Canada's definition of disability. What I found is that they don't have a single definition. They say, look at the World Health Organization and the UN on their rights for people living with disability. If you then go to the World Health Organization, they say, okay, we also refer to the UN. So the UN, they say, persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments which interact with various barriers or may hinder their full and effective participation in society on an equal basis with others. So kind of broad, but that's also what we consider a social definition of disability, how we are able to participate or not participate in society. If we then look at other departments from the federal government, such as Statistics Canada, for their census, they say that disability is defined by this social definition, except when it comes to intellectual or developmental disability, in which case it requires a medical diagnosis. So this is the medical definition of disability. You have to access medical systems and receive a diagnosis in order to qualify. So again, kind of confusing, doesn't really mean much. So why do we do this? Well, first, we need to consider that the way that we approach our communities needs to be accurate to our communities. People with disability are all over the place. There is no one way to live or not live with disability. It simply is a part of our lives. However, in terms of how we understand disability, it's important when we're talking about client prioritization in our intake processes. It's also important to reflect their realities in all of our programs and services. So it's useful for us to know for our case managers who work with clients. It's useful to know for our ability to advocate to our governments for funding or other systems for improvement. So let's talk a little bit about the methodology or how we approach this. We can really break it down into three main chunks. First, we have very limited or no data. So essentially what that means is prior to 2021, 2022, we didn't really ask about disability in our community. So St. John's, for reference, is about 212,000 people in the St. John's metro area. St. John's proper is about 110,000 people. So relatively small as a city compared to other areas, but that's kind of the demographic that we work within. In around 2021, 2022, we started getting more intentional about how we asked about disability. And then in this new iteration of our intake process, we're then getting even more intentional and getting thicker or more complete data. So for example, in our previous intake process, this was the question that we had developed in partnership with Empower NL, the Disability Resource Center in St. John's, Newfoundland. So as you can see, we provide staff who are administering the intake assessment to clients with a definition of possible types of disability. And we ask clients to self-identify. Do you identify with having a disability? And if so, is it permanent, temporary, you're not sure, you don't want to answer? And this is a real example from an intake that we got. You can see how the caseworker that was working with the client identified that this client had COPD and was in a wheelchair. We didn't have a space other than at the end of our intake process to say, is there anything else we should know? There was no dedicated space in order for people to ask that question or give us that information, which then impacts clients' abilities to work with their case managers and vice versa. So what really started this off in order to get the thicker data was the 2024 PIT count. I was the PIT count coordinator for the St. John's region, and part of the PIT count, for those who aren't familiar, is it asked a bunch of questions about people's experiences with what are effectively different disability types. So for example, mental health, substance use, learning disorders, things like that. And what we found is of the 158 or so survey respondents, 92% of them identified with having some type of disability. And 75% of them identified having comorbid or two or more types of disability. So this was pretty significant for us because we have a pretty comprehensive intake process where the PIT count actually doesn't usually tell us a whole lot. But in our own by name data, we found that only 55% self-identified as having a disability. So that led us to question, is disability or the identity of disability a social thing, or what is it? So Then we embarked in our intake process. In terms of our journey, it's a lot more complicated than that, but that's kind of the backdrop or backbone of that. So in working with Empower NL, we went through a very iterative or circular process to asking about disability. This involved us getting together as a group, an organization, and a team and asking ourselves what our goals are. Again, being intentional. We then broke into an internal working group in which we met weekly that consisted of us in what we call the data den, which is myself, Anissa, and our colleague, Katie Van Conant. And we also included people from the coordinated access team, and we created a list of what we needed to know as we were transitioning into HIFIS. So in that process, we asked ourselves, why are we asking each question on this intake process, and what information is it providing us? It's really important that we don't ask extra information because, as everyone here knows, it can be really re-traumatizing or triggering for clients. In then doing that, we then engaged in our internal stakeholders, so our community advisory board. We also asked our outreach team, who work directly with clients on a day-to-day basis, what they were noticing, what they had trouble with in administering these intake processes, and so on and so forth. Then we engaged in the Coordinated Access to Homes Working Group, which was a subcommittee of the CAB, and then we piloted a draft of it with our outreach team, and then went through the process of refining it again. So this ended up for disability specifically looking a little bit more like this. So it looks like a lot when we're looking at it right now, but we provide pretty good training with our with Anissa as our HIFIS lead and some of our other colleagues. So people get really used to it really quickly, and we provide ongoing training so that it's not a one-off. As you can see here, we've really broken down disability into all of these different categories, and we don't ask, do you identify with disability in this question? Because HIFIS requires us to have a yes-no toggle of disability, we do ask at the beginning of the questionnaire or intake process, do you identify as having a disability? Then further along in the intake process, we then ask this question, do you experience any of the following? This is incredibly important because, again, a lot of people may experience these things and struggle with them and need resources for them, and not necessarily identify with disability. So I'm going to turn it over to Anissa now.
Hi. Hello. So I'm going to briefly talk about how we translated this kind of new intake form specifically for the disability question into HIFIS. So if you all are familiar with HIFIS, if you are a community that uses HIFIS, it is the Homeless Individuals and Families Information System. Nailed it. Nice. And HIFIS 4.0 does come preloaded, as Chris mentioned, with a disability question. However, it is just a yes-no toggle, which isn't necessarily as comprehensive as we would like based off, everything that Chris has shown you. Got real loud there. So to kind of account for this, what we ended up doing was making a custom table. If you're familiar with HIFIS, that might be a little like, oh God, they can get a little finicky, but they are extremely customizable, and that really helps you kind of shape HIFIS or your instance of HIFIS in a way that allows you to ask these more, pressing questions to your community without having to rely on kind of like a stock answer. So this is fake client data. And what you can see here that I've highlighted in orange is where disability shows up in HIFIS on the client vitals page. As you can see up there, it's just a yes for this person because it is simply a yes-no toggle. So that is kind of what we were starting with in terms of kind of usage of disability in HIFIS. And where we're going is a fully fleshed custom table that you can match to the intake that we created and then be able to record that information and get it out. So in kind of determining how to craft this custom table, if you've ever played The Sims, you will know that having an insane access to customizability can sometimes overwhelm you. If you want to talk about that later, I'm here all day. However, one of the things that can really help kind of guide you and format that is to think about what you want out of kind of this custom table. For us, we needed a record of individual responses to help with matching and prioritization, so something that a person a staff member at a local shelter could go in to look at that client's file and see the information they needed to see without having to do some type of complex coding or what have you. We also needed aggregate information about the distribution of disability across our community, a way to kind of collect that information at a de-identified aggregate level to present to people that may be interested, perhaps funders, and say, look at what is happening in our community. These are some raw data. These are some numbers. I know that can be kind of frustrating sometimes having to rely on that, but it is very helpful in terms of kind of helping people understand and see what your community needs. Handing it back to Chris.
So I'm briefly going to go over some of the results of our initial test run with this. So over the course of 1 month, we put our survey, our new intake process out into the community, and we said, please use this. Based on about 38 new intakes that we received more than that, but they were using the old one. So based on 38 of the new intakes, what we found when we asked people, do you identify as having or living with a disability? 50% of people said, yes, I do. 50% of people said, no, I don't identify as living with a disability. However, when we look at the new question that I showed you earlier, what we find is that 87% of the 38, so 33 people, identified having disabilities. And a lot more than that identified, or a significant portion of the 50% identified having 2 or more disabilities, or 74%. So again, that leads us toward the idea that disability in and of itself is a social category or social reality. It doesn't necessarily reflect client internal systems, how we identify, how we navigate systems. So it's important that we ask these questions in a way that captures this. So breaking it down a little bit, you can see that pain, for example, is the highest rated one. Almost everyone identified having some sort of pain disability or limitation of some type. Now, we need to compare this with the PIT count that we did, because again, this was inspired by the recent PIT count. And what we find is the distribution is largely the same. The PIT count didn't ask about pain-related experiences or disabilities, so it is important to note that pain is overwhelmingly present and impacting the lives of our clients. But this gives us some idea that the results are pretty similar across the community based on how we've asked this question or asked our service providers to ask this question.
So what I'm going to show you now is basically what this looks like in HIFIS. I've embedded a little video here, and I'm just going to talk you through it. You can see here in the hot pink thing, we are on the test site, so no worries about if you're like, whose data is this? It's fake. One of my little favorite people. I love naming them, Sims. So what you can see here, you navigate to custom tables, and we have it set up to basically match the intake kind of with that blurb. This is a very scaled down version of our actual custom table, but this is the one I'll be kind of providing you with resources to kind of mirror in your own communities. Once again, kind of that multi-select dropdown. I think I'll show an example here where I should select more than 2, but if I don't, oh well, I'll just say it now. Yeah, people can multi-select in these boxes. There are further questions of like, are you just saying I don't wish to answer? There's also space in the custom tables to further clarify free response boxes. And once the little, and then you can delete all of that, hit save. And this is what it looks like from a user's perspective. So if you are a shelter worker at one of our shelters, this is information that you would go in and fill out about a client, but it is also information, as you can see here, in a kind of like, if you're familiar with HIFIS, when you look at a custom table after you've done it, you kind of have to go back in to edit it to see it in the pretty way. But it is accessible for that shelter worker to then go back in and look at this client's information and have that, real-time knowledge of, oh, this is what is impacting this person that I'm currently serving. So, there There we go. What I'm going to show you now in my remaining time is an overview of the report that we crafted to go with this custom table. So one of the great things about HIFIS is you can put data in and you can get it out. It can just be very finicky sometimes in terms of how to get it out. So what I wanted to provide you all with was a way to kind of take this report that we've made and take it back to your communities, craft something similar, craft something different, and then be able to get that information out. So this report that I'll show you provides kind of a snapshot of what disability looks like in the community and reflects, hopefully that most up-to-date and accurate information, as is always the wish with HIFIS. So what I have on screen here is just kind of, once again, fake data, a little snapshot that shows you the instances of disability by duration. So those kind of episodic, temporary, permanent, unsure. And what I want to highlight here, because these numbers might look a little strange, is that these are unique instances, or these are individual instances, sorry. So a person might have a permanent pain disability, a temporary learning disability, a episodic dexterity challenge. All of that is represented in this graph. It's not necessarily one client is represented once. It is any instance of them clicking, saying, yes, this is something that impacts my life. This shows up on here. If you don't want to look at it in kind of this, I did my best with the colors, but Crystal reports. If you don't want to look at it in this little table, we also have on the second page, a full table just of raw numbers, if that's more your speed, which once again kind of shows that same information. I have a more detailed look through of the report itself. If you'd like to see that later, feel free to come find me. But for now, I will move on to conclusions. So disability is very relevant to homelessness. This is something that we have been seeing more and more of in our community, and it's especially important in terms of the different demographics it impacts. I feel like sometimes there can be that assumption that it's only impacting, elderly age groups, but it is something that is present throughout many people's lives and impacts their ability to access resources. And improving the way, kind of the key point of our presentation is improving the way you kind of ask this question improves the knowledge you gain. As Chris said earlier, there is no perfect way to ask a question. Just improving it in any way can help you get a little bit more knowledge, figure out a better way to ask it next time, and keep that process going. And yeah, better information benefits clients. They have the ability to tell their story in this data, to be like, this is my life, represented in a way that is true to me, true to you, and we can engage on that. Better for staff to know how to help the clients that they are serving, and better for communities and systems. And I think that's all. Thank you so much.
Perfect. So thank you there to End Homelessness St. John's. Congratulations on being within 10 seconds of 20 minutes. That's definitely award-winning at that point. And yeah, now I'd like to hand it over to Calgary Homeless Foundation to speak some more. Thanks.
All right, thanks everyone. My name is Michael Grant. I'm the manager of system planning at the Calgary Homeless Foundation. I'm very happy to be speaking to you all today about our community's transition from what we call the Needs and Services Questionnaire, or the VI SPDAT, to a new coordinated access and assessment triaging tool called the Coordinated Entry Tool. So just a bit of an overview of what I'm going to talk about today. So I'm going to do a very, very quick overview of CAA because I'm assuming most of you are familiar with that. We're going to talk about why we decided to replace the Needs and Services Questionnaire, the process that we used to develop the new tool with the community, some highlights of the actual tool itself. And unfortunately, I was going to do a dashboard demo today, but we're having some technical difficulties, so I'm not going to be able to do that. But if you'd like to see it in action, please come find me after the presentation and I can do a quick demo for you. All right, so for coordinated access and assessment, very, very high level, it's a system that matches people experiencing homelessness to housing and the supports that they need. And the Calgary Homeless Foundation oversees and coordinates this process to shift the challenge of finding the right services away from the person seeking help into a network of agencies known as the Calgary Homeless Serving System of Care, and it's in order to meet their needs. So just a bit of an overview in CEA in Calgary. There's some key components. So we have multiple access points or door agencies that we call them. These door agencies are usually emergency shelters or outreach teams, such as encampment teams, that have what we call trained housing strategists that are working as shelter workers or case managers or things like that that are trained to administer the needs and services questionnaire with participants. Right now, we have about 270 housing strategists, and the key is to cover a large geographical area so folks don't experience barriers when trying to access CAA. Part of it is, we have our standardized assessment. So I talked about the needs and services questionnaire. So what this is the VI SPDAT, but we've added some additional questions over time to meet the needs of our community and our different programs that we refer folks to. We have, like I said, a lot of outreach and engagement teams that are going into the community and meeting folks where they're at to complete the needs and services questionnaire. And then also we have our placement committees. So currently right now, we have weekly placement committees for adult singles, families, and youth who meet every week to review our triage list. So to put it in perspective, right now our triage list is at about 1,700 single adults waiting for supportive housing, and the supply far outweighs the demand. So we need these placement committees to look at the information in an equitable way to make sure that folks are getting the supports they need. So today we're really going to focus on our standardized assessment. I'm going to talk a little bit about how that intertwines with placement committee as well. So why did we decide to replace the needs and services questionnaire in Calgary? So it was determined, there really was a mismatch between the NSQ and the community needs. So it doesn't really consider our local context and local community and the composition of the people served in Calgary. And we received some feedback, a lot of feedback around this on an evaluation that we contracted out. So we'll be talking about that soon. We found that there's a lot of irrelevant questions. So what do I mean by this? So many of the questions on the NSQ were found to be both irrelevant were both irrelevant when triaging into supportive housing, and then also it had the possibility to re-traumatize folks. As a lot of you folks using the VI SPDAT know, there's a lot of criticism around that piece. And then also we found that there is a flawed scoring system. So this scoring system was not reflective of a person's situation, complexity, or vulnerability. So we tried to remedy that through the creation of this new tool. And then the creator, actually, OrCode, did say that communities should move away from the VI SPDAT and either adopt a currently existing tool or create their own. So we decided to create our own. And that would be the coordinated entry tool. So I'll talk a little bit about that process, and we did it in 3 phases. So the first was an evaluation of the needs and services questionnaire. So CHF contracted Rita Abood to evaluate the effectiveness of the needs and services questionnaire. This was done through consultations with many different stakeholders in the community, be it CHF-funded housing support programs, housing strategists, folks with lived experience, primary systems like health and justice. This is done over a period of about 4 months. And the report concluded that we should move away from the VI SPDAT and create our own tool. At the same time, we've created what's called a research advisory group, and it was made up of various agency partners from the homeless serving system of care, which included CHF staff and leadership from CHF-funded and non-funded supportive housing programs. So this group was consulted and provided feedback throughout the process, which was about 1.5 years. At the same time, and this is probably one of the most important parts, we developed 9 guiding principles to really guide us through the development of the new CAA triage tool, which are. So these were determined to be very important pieces to focus on when creating a new tool. So the first is it needs to be person-centered and strength-based, it needs to be trauma-informed, it needs to be culturally supportive, especially for Indigenous people and communities. It needs to be relational and contextual. purposeful, effective, and relevant, transparent, equitable, respects privacy and confidentiality, and this is a big one, they didn't want it to be scored and have more qualitative information. So really during this whole process, we use these as kind of our North Star when developing the content of the tool. So the next phase was phase 2, which is the data collection and the actual design of the new tool. So we held a World Cafe style consultation with 50 plus of our CHF funded and non-funded housing program staff and housing strategists to receive input on the creation of the new tool content based on those 9 guiding principles. And we created a report that outlined those findings. At the same time, we contracted Nick Falvo Consulting. Nick's actually here today, which is great. And thank you for all your work on the tool. To consult with 100 plus different stakeholders that interact with coordinated access and assessment and the needs and services questionnaire to receive guidance on the creation of the tool. So these consultations included Indigenous peoples and Indigenous-led organizations and persons with strong knowledge of second-generation approaches to CAA triaging tools, which specifically the STARS tool, which Toronto is using, and then also the PATH process. Also consulted with those primary partners, so health officials, justice officials, persons with lived and living experience, staff who worked with racialized groups, and then staff who worked with persons with disabilities. So this was done over a period of about 6 months, and an interim report was created by the consultants that synthesizes that feedback, and we use that in the creation of the new tool. And so using this feedback, the consultants worked with CHF staff and housing strategists from the Distress Center Coordinated Entry Program, which they're also here as well today and were instrumental in the creation of this tool to create the first draft of the tool that we used for piloting. So phase 3 really was about piloting and testing the tool. So we identified a group of 6 housing strategists from various agencies that serve diverse demographics to actually administer the CET with participants who had already done a needs and services questionnaire. And they were able to complete 25 of them during this time, and everyone was given a $50 honorarium for their time. The housing strategists provided feedback on the process and about the tool and the administration process, and during a focus group session with the consultants, but also through a survey. And then we also collected feedback from the participants that did the CET and compared it to their experience with the needs and services questionnaire. And all of this feedback was used to further edit the content. We also held a mock placement committee. So this is where we were going to show you the dashboard, because folks would enter actually the information from the CET into HMIS, and that's what we use in our community. And it goes into a program called Click, and we're actually able to see all the information in one place to help with triaging. So we did a mock placement committee using this information, and we received further feedback on that. We also importantly did Indigenous elder consultations. So we actually did this with 2 different groups of elders, and we did this through ceremony and circle, and they were held by Indigenous-led organizations in Calgary. And the purpose of these consultations was to confirm if the CET is culturally sensitive and safe for Indigenous participants, while meeting the needs of those communities, these communities, and connecting them to appropriate supportive housing resources. And this further informed the content of the tool itself. And then at the end of March, we had the research advisory group members vote on whether they thought that the tool met the 9 guiding principles. And the majority of them did vote that it did, and we can move forward with the implementation of the tool. But we remain in conversation with Indigenous-led organizations and elders to continually update the content to be more culturally safe for Indigenous people. So here's some of the highlights of the coordinated entry tool. So this is a big one. So it's created and owned by the Calgary Homeless Foundation and the community. So what this means is it allows us to be responsive to emerging community needs and edit the content as needed. So with the VI SPDAT, you're not able to actually edit the majority of the questions. So this allows us to be iterative in response to the needs of the community. The whole process was community-led, so it was completed in collaboration with key agency partners and community members throughout each phase, which is very important, and we will continue to do so in different versions. There's a reduced completion time, so we heard feedback from folks, housing strategists, that a family NSQ would take anywhere from about an hour and a half to complete. So we found that with this, there's a reduced completion time for both participants and housing strategists through what we used as a modular approach. So before there was 3 different versions of the VI SPDAT, family, youth, and adult. We've now put it on to one. And there's real focus on how the tool flows. And we receive feedback that it takes about 30 minutes to complete now, which is great. It's not scored, and that was a big piece of feedback that we heard during these consultations and from the community. And so we're trying to determine participant complexity by a mix of qualitative and quantitative factors now. There's more purposeful questions, so fewer and more relevant questions focused on areas that directly affect pairing an individual with a housing program. And then we're really trying to balance the qualitative and quantitative questions. So as you know, the VI SPDAT is a lot of yes or no questions with scores. And we heard a lot of feedback from the housing programs that we were referring to that this didn't give them the information that they needed to really understand a person's situation, and it led to a lot of referrals that didn't work out. So we've really added more qualitative questions, and it's better information at our placement committees to make more appropriate referrals to housing programs, but we also need those quantitative data points as well. So we believe that we've gotten a good mix of those throughout this process. So we got feedback that the tool is more person-centered, strength-based, and trauma-informed. So the wording in the questions is more relational, and it's based on the feedback from stakeholders and participants. So I can give you an example of kind of a comparison. So there's one question on the actual NSQ. So it's, do you ever do things that may be considered to be risky, like exchange sex for money, run drugs for someone, have unprotected sex with someone you don't know, share a needle, or anything like that? So that's a very awkward question to ask, I would say, and a very awkward question to answer as well. So on the CET, we've changed it to, can you please describe, are there any challenges or risks you might be facing that could affect your overall well-being, safety, or stability? And we found that that was a better question to ask. And then we also had another one just under the mental health module. So this is a question that we use to refer to assertive community treatment housing program. So, and it's for folks who are diagnosed with Axis 1 thought disorder like schizophrenia or things like that. So the original question was, have you ever been diagnosed or prescribed medication for a mental health concern? If yes, have you ever been told you're diagnosed with schizophrenia, schizoaffective disorder, things like that? We actually talked to the program to understand what would be a better question to ask for folks. And so we changed the question to, do you or any family members sometimes have trouble with your thoughts, like feeling confused, hearing or seeing other things others do not, or feeling disconnected from reality? So go back here. So we have multiple program type options in this version as well. So before, at the end of the NSQ, housing strategists go through a list of different program types, like say place-based supportive housing or scattered site or bridge housing, and they would choose one that they think would best meet the needs of the participants. But we found that it would really put people into just one category when theoretically they could be served by many different program types. I'll go back to the assertive community treatment program type flag. So once someone right now is flagged for that, they are just on that list. There's limited spaces available for that specific program type. But in reality, they could be served by a scattered site program as well and have an ACT team following them in the community. So now it just opens up more options for folks, so they're not limited to just one program type and ostensibly in limbo for a period of time until a space comes up. Yeah, and so the new tool as well has a big focus on prevention and diversion. So one of the first questions after basic information is entered is, are you currently housed or is this your first time experiencing homelessness? If they say yes, then we advise actually not to do the tool and look into other resources first, because there's so much of a demand with limited spaces. Like, does it make sense to go through this large assessment only to maybe wait a very, very long time to get a referral or never get a referral? And in Calgary, we have a lot of options for prevention and diversion, and we've invested heavily in that. So it's hopefully going to get some people housed faster than having to wait on the list. Yeah, we've reduced privacy barriers to entry, so we were able to move actually to a verbal ROI. And this greatly reduces folks' barriers to enter CAA, because before, if someone filled it out incorrectly or put the wrong date or anything and they uploaded it, if it was wrong, then the housing strategist would have to go back and get the proper document uploaded. So now we can just do a verbal ROI, and it greatly reduces the barriers for someone showing up on our triage list. And then, we did a lot of Indigenous community and Indigenous-led organization consultation and feedback. And there was generally very positive feedback, but I think we still have some work to do there. And again, like I said, we're still in contact with those organizations and elders to continuously update the content to be more culturally safe for these folks. And so this will show you here. So we enter all of our data into HMIS. So on the left is the NSQ. So you can see that we have all the questions there. It's a lot of yes or no, ones or zeros. And then you can see on the right, we have that mix of the quantitative and qualitative data. So it's really filling in the gray, I would say, because not having that qualitative information and just focusing on yes or no, these kind of things, you don't get a good sense of a person's situation or what their needs are. So this gives us greater insight into what folks need. Like I said, we're going to do the dashboard, not able to, but please come find me. See it. Yeah, and our next steps. So we're currently in the process of planning for implementation. So what that means is we're updating our training for housing strategists to train all 270 of them to complete the CET. We're updating documents like the terms of reference for our placement committee, and we're planning to probably in the next year launch that process of transferring all folks who are currently entered into CAA and have an NSQ onto the CET. And then we're going to discontinue the use of the NSQ after a period of about 3 months. And then this is an important part. We're going to establish a process of feedback from the community so we can constantly be responsive to the community's needs and update the content as needed. And yeah, this is my contact information. I also have our manager of coordinated access's contact information there. If you would like me to send you a copy of the to chat anything related to it. So thank you very much for having me today.
Thank you very much. Okay. Okay, and now I'd like to welcome Ship to speak a little bit about data justice.
Good afternoon, everyone. We're truly honored to be here today and share space with End Homelessness St. John's and Calgary Homeless Foundation. For today's session on reducing homelessness through equitable, innovative data collection, Shireen, Sajjan, and I are here to talk specifically on how data justice can support the reduction of homelessness in diverse regions. So myself, I'm Nicole Abruscato. I go by pronouns she, her, and I'm the manager of Central and Taken Access at SHIP. We have Sajjan Jacob, who goes by pronouns he, him, and is the data management analyst at SHIP, and Shireen Ramprasad, she, her, manager of our equity, diversity, and inclusion team. So our objectives today are really going over to align ourselves with making the offer for data justice, aligning our waitlist management data to data equity, and bringing it all together through community collaboration. So a little bit about who we are. So we wanted just to introduce ourselves. To those who may not know who we are, SHIP is a nonprofit accredited through Accreditation Canada, service and housing provider for the last over 30 years now in Ontario, so serving areas of Etobicoke, Peel Region, Dufferin County, and the region of Waterloo recently. And so our mission is that we work to support those who have a mental health and addiction challenge to increase their quality of life and live to their full potential through safe, affordable, and community-based housing and services. And our vision is that of quality housing, quality services, and quality lives. Oops, sorry. Paper following here. And as many of us have in the social service sector, we love our acronyms, and our values are of that of CHIRP, so C for compassion, H for hope, I for inclusion, R for respect, and P for professionalism. A little bit more about us. Like I said, we've been in the business for over 30 years now, have over 500 staff employed at SHIP, serving over 5,000 clients, have about 12,000 housing units. We have 11 SHIP-owned buildings, and our waitlist is over 2,500 people. We are also supporting uniquely on a housing and service continuum, looking at how we support those who are in emergency shelters all the way to affordable market rent. So looking at how to support those who are youth, adults, and family through high intensity all the way to our low intensity support. So really providing that mental health case management and or addictions so that folks can live successfully and independently in the community, and it's guided by their own goals. Our approach to EDI is that of a framework that we've developed over the last few years, and it's really about moving away from performative allyship to meaningful action. And so we do that through demonstrating it through our EDI and integrating it into all that we do in our culture, our values, and we set goals and commitment to acting on our action plan. We have 29 activities for deep, meaningful change in the areas of our people, having our workforce be broadly reflective of the community we serve, our culture, having our workforce be inclusive for all, and our systems by identifying and addressing barriers within our organizational systems and processes. And we hope that this will be evident through our presentation today. A little bit of why we wanted to be here today. So we recognize that we don't represent all organizations or the sectors joining us here today. However, we believe that data justice is translatable. And coming together and learning supports a united stance on how we can move forward in aligning with data justice. Lastly, we recognize that we're not experts. We're here to share our experience in how we are building impact within our organization, but we also want to learn from you all. So I'm going to pass it over to Shireen now to talk about shifting the narrative on data justice by making the offer of data equity.
Thank you, Nicole. Thank you, everyone, for joining us. I get the privilege of talking about something a little bit different. I think many of you have attended sessions this past couple of days that talks about data, and we had some wonderful presentations just now about the actual data and what data can do. What I'm going to talk about is data equity and what are outcomes and what we use data and how we collect data with the communities that we serve that are diverse, and how you do that in an equitable way. So I have a lovely diagram, and hopefully it's familiar to some of you. I love this diagram because it's very nostalgic. If you recognize it, the pictures are from The Giving Tree, a book that many of us probably had when we were children and maybe use with your own kids or communities today. But what this will help us illustrate is the difference in the movement from inequity towards justice. And if you just look at the first picture on the top left, it's an example of inequality. So what you'll notice is that there are two people. Both of them would love the apples on the tree. But if you see, the person on the left is able to access the apples on the tree because of what? The tree is bending towards the left, and there are more apples available to the person on the left. That's an example of inequality, where the tree is providing, though both people are there, the tree is providing more access to and more apples to the person on the left. If we move to our right, the next example is how we move towards equality. Equality says that we give people the same thing to meet the same need. So no matter what their needs are, we just give them the same thing. So if you'll see, we've given both people a ladder, the same ladder, to try to get them access to the tree and to the apples on the tree. But what we've essentially done is provided the person on the right with hope where there isn't any, because you see, they still cannot access the apples on the tree. But we've given them a ladder, so they should be satisfied. They still can't access it, and the tree doesn't provide the amount of apples on the right that it does on the left. Now we move towards equity. Equity says that we give people what they need to meet their unique needs. So we assess what people need, and then we provide that to them as individuals. In that example, you'll see we've given the person on the right a taller ladder. So they're now able to reach the apples on the tree, as is the person on the left. But the apples on the tree are less. They're less sparse for the person on the right. So have we really achieved equity? What we ultimately are working towards is justice. Justice says that we fix the tree. Then, once we fix the tree, we can give people what they need, and that might be the same thing, because what we fixed is the system. We are the system. We are the tree. Service providers, the systems that operate on people, we need to fix ourselves before we can start talking about giving people what they need and making assessments. So when I talk about data justice, use this example in your head. When we're collecting information, socio-demographic information, looking at inequities within our communities and our services, this is what we're really looking for. Ultimately, we're working towards using data for justice. And justice requires reconciliation. So it's not going to be easy. It's not going to be easy when we collect this data because people don't trust the systems that have always been bent one way or the other. So, why is there mistrust? I'm sure many of us in this field have had the experience of asking people what we consider to be pretty simple questions. What's your race? How do you identify? What's your gender? Pretty simple on the surface. But when we dig deeper, there has historically been a deep mistrust of those questions. Why is there a mistrust? The mistrust comes from a number of different places. Oh, sorry, just gonna. Yeah. Sorry. There are many reasons why vulnerable, oppressed populations mistrust systems and data collection. One of the greatest reasons is scientific racism. One of the most effective tactics that societies have used to justify racism and oppression has been scientific racism. It has taken many forms through the years, including here in Canada, the 60s scoop, where data was used as a reason to remove children from schools, from their homes into residential schools, where data was used as justification to starve children and experiment on children and Indigenous children in our own communities. the Tuskegee syphilis studies in the States. There's another example of where people were tricked into providing their information, participating in studies with false promises for better health outcomes for them that weren't actually true. And then Henrietta Lacks is a good example of how a Black woman was used and abused within a system that she was never compensated for, and her genetic code is to this day still used in scientific research. The main objective of scientific racism is to co-opt the authority of science as objective knowledge to justify inequity. When we look at the next one, colonization, I think, is self-explanatory. All of our systems are colonized systems. So an act towards justice and reconciliation is decolonization. In order to look at decolonization, we have to take into consideration the 7th generation principle and intergenerational trauma. This is the idea, the indigenous teaching, that encourages people to consider the impact of our actions today on the next 7 generations. This relates to the idea that intergenerational trauma, which is passed down through generations if unresolved. Data collection has been a source of trauma. It has been a trauma experience for many communities, where data has been weaponized to perpetuate colonized ideals and inequities. So keep that in mind when we talk about how we're collecting data and why we collect data, but most importantly, what are we using people's data for? So why does asking demographic data matters? I just kind of told you, like, be careful, scientific racism, and I gave you this big, long spiel. But why does it actually matter? Why should we still do it and make every effort to do it equitably? This is the why. Clients matter. They are at the top of this pyramid that you see here. Clients will feel better understood, welcomed, and included when we ask questions, and you'll see in a second that we don't ask questions at SHIP. We train our folks to make an offer instead of asking just these checklist questions. Our staff are important. That's why we do our data equity training and programming. We want to be able to have an overall picture of what our community needs are, of what individual needs are. We want to be able to better serve those that have those needs. And we want to reduce, for our staff, there's a reason why we train around data equity the way that we do. We want to reduce the burden on staff. We want to hear what the things are that are bothering them, what their concerns are, how challenging. I don't remember which one of you said it, but it's hard to ask these questions. It's uncomfortable for us as well as staff. So we want to acknowledge that, and we want to really help people move through these processes because the intentions are there. The impact is what we need to focus on. And certainly our systems, advocating for health equity and justice, consistency and alignment, and continuous quality improvement are important reasons why we ask about demographics. So like I said, we don't ask questions, or we train staff to move away from asking these questions that are on a checklist. We already know how to do that. We ask a lot of questions of our clients every day. When you're having a visit with clients, and we do home visits or community visits, really creating the space, using your empathetic approach. And we all get trained in motivational interviewing and all of those kind of colonized ways of doing things, but just being a human being, be a human. Create a space for people to tell you about themselves authentically. You don't need to ask questions for people to, if you offer space for people to tell you who they are, they will, if they are comfortable. We stress building trust. You build trust with people, and when you offer that space to people, they will just tell you what you want to know anyways. When you build relationship, people will take to that, and they will tell you their ethnicity, their gender identity, because they trust you with their information. The other piece of this is that for our purposes, if a client doesn't want to tell you, that's okay too. That's not a reflection on you as a staff. It's not that you're not doing your job. They have the right to not share about themselves, as do you. Maybe it might be that you need to build more relationship, build greater trust, and that can take time, but that's okay too. This will always be there. Our data management system will be there. When people feel comfortable to offer you the information, that's when it's right. And that is when we can do something with that information. Until the point that people are comfortable providing their information because they trust that you're going to use it appropriately to benefit them, we don't need it. If we haven't built that relationship, then we don't need it, because we're not going to use it properly. We're not going to appropriately use their information to add value to them. Then the other important part of this is about, we always want to explain the why to our clients. I know many of us have been trained when you're doing assessments, you go in and out and you do the assessment. But do we really ever explain why? Why are we talking about this? What are we going to do with your information? Why does this benefit you as a client to help the system to become decolonized? That's important conversations to have. Our clients are adults. Our clients are being oppressed by the system. So why not have those conversations with them? Give them the space to be able to tell us about their experience, about who they are, how they identify has impacted their experience, about how we are impacting them. That's what one of the big parts of us in our data collection is, having the conversation about the why. And what could the value be that we can bring to clients and their experience within the systems and within our services when we talk about the why. Okay, I'm going to pass it to the expert, Sajan. We couldn't do any of this without Sajan. And we were supposed to do a bit of a demonstration as well live, but the technical difficulties that Michael had as well are ours as well. So Sajan will take it away.
All right, thank you so much, Shireen. So as Shireen said, due to technical difficulties, we're unable to show you the live demo, but if you do like to see a live demo of our dashboard, please feel free to find myself or any of my colleagues, Shireen or Nicole, and we'll be happy to give you a live demo. But essentially what we're looking at here is what we call our MHA PDS audit dashboard. This is the first page of our client dashboard, and you're probably wondering, okay, among the many acronyms we have in mental health, what does MHA PDS stand for? So for those of you who don't know, it's the Mental Health Addictions Provincial Data Set. It's a standardized set of client demographics that the province of Ontario is collecting. And so this first page of our dashboard, the pie charts that you see right now, they kind of look like olives, right? When we first launched this dashboard, these charts actually looked like watermelons. So you can see the gap in these charts. What it's showing is the aligned and unaligned rates of the demographics that we're collecting. And the green part of these graphs represent the aligned rate. So aligned meaning, have we asked the question to our clients and has it been collected of the standardized elements that we're supposed to collect? And the red portion is the unaligned. So unaligned being it hasn't been completed at all, or it's using incorrect values. Okay, and so for our overall agency that is currently reporting these demographics, we're currently at almost a 93% alignment. So pretty good, right? We have it in green to make our agency happy and feel proud of the data that we're able to collect, but it's not 100%. And so moving to the next part of our dashboard, so what you initially saw was more of the audit side of our client dashboard. So that's going to be more helpful for our programs to track, okay, where do our programs need to focus more on collecting these key demographics so we can understand our clients. And so when we enter this part of our dashboard, this is where we can actually see the key insights of the types of clients that we're serving. And so for each of the different demographics, we're collecting over 20 demographics in our sector. And for each of our programs, we can see what kind of clients, based on their social determinants of health that they have shared with us, are we supporting? And so this will help each of our programs make more tailored key decision making to support our clients. So you can see there is a little red portion in our graphs to show, okay, areas where this data is there's still a difficulty in having the data collected. So for example, if we see an area like religion or education, right? These look like they're having a very high unalignment rate, right? And so that shows that this is an area where either the question is not being asked or certain people are finding it difficult to ask that question. So maybe that's an area that we need to focus more on to see how we can get that information. And so this next slide is just a second page of our dashboard. And again, it helps us get those key insights. So for example, looking at household income and residence type, right? Or income source. We can see that almost 45%, so that's that big red portion at the bottom of the screen there. Most of our clients, based on their income source, almost 45% of our clients have an unemployed income source, or they've identified that as their primary income source. And so that kind of speaks to how housing and employment speaks to the high homeless rate that we need to support. So this is where this dashboard can help make those that visual insight of the clients that we're serving. So again, that's all I can kind of show you right now of our dashboard. But again, if you'd like to see a more live walkthrough, feel free to visit us at the SHIP booth, or if you find us somewhere in the hallway. So with that, thank you, and I'll pass it over to Nicole.
And I'm just going to go quickly, noting the time, and we want to give space for questions. So the important part of this dashboard was really to provide us with a visual tool to map. We have this information. We use a client record management system, or CRMS, and trying to extrapolate the data is really difficult. So we spoke to Sajin, Shireen, and I, and how can we do this as a visual mapping, so we were able to get this into Power BI. But the really important part, and it shouldn't be telling the store, it should be telling the story, making the impact, was we saw a notable unalignment rate for veteran status. And you'll note that we didn't talk about this as a compliance rate, as we're talking about people, and we should be aligning ourselves and our services to the people that are accessing the services. So we call it an alignment rate. So through collaboration with connecting with a local Legion and police services, we were able to have training to properly train staff on how to ask the question about, have you ever served, or are you a veteran? As we were finding a lot of people were saying no to the question of being a veteran, as opposed to, have you served in the military? So we were able to leverage that partnership, and then also have a direct service pathway with regional police systems in Waterloo and Peel region in order to support those who have served. So again, quickly, because I don't want to take away time from questions, but this really shows about how to leverage your supports with community organizations where you may not be the subject matter expert, and then you can leverage that to support the community and those that you serve. So looking at demographic data is really important in showcasing that. Looking at partnering with staff and client to get that engagement, because again, nothing about about me without me, and that includes staff in that story. And emerging sectorial trends as well is really important. We just wanted to highlight that we were part of a community practice model with dataforchange.ca, so you'll be able to see a little bit more of the training that Shireen and I did in a 4-part series really talking about data justice. And then these are just some takeaways today, but I'm gonna hold off on this. I'll just leave it up on the screen. We have our business cards if you'd like to connect with us later on. We do welcome that and appreciate everyone's time today, so thank you.
So thanks there for Ship. Can you, yeah, there we go. Thanks. So yeah, thanks again to Ship for that presentation. I did tell you all we had some great presentations, and I don't think they disappointed. So I hope you all got a lot from them. We can now have some questions from the audience. If people want to put their hands up for questions, we do have a microphone circulating around. Go on there.
Thank you so much for the presentation. Just a quick question. We've seen that we have around 45% misalignment with regards to the type of residential housing. Would you please explain from where this discrepancy or misalignment stems?
The misalignment for residential type is that staff didn't input the information that was one of the appropriate data sets that we had selected. So we had to do a retraining with staff to help them understand the different types of definitions as per the ministry and the government of what shelter means or homeless means, as opposed, like, we may have a different definition of that internally, but we needed it to align with our provincial funder. So it's all about that training and the explanation so that staff have the autonomy to do their work and do it well. Great question, thank you.
Oh, hi. I'm here from Whitehall's, Yukon Territory. We are now in HIFIS 100%, and we are soon moving from VISP-DAT to PAD, which is an Indigenous-led assessment tool. But it is like a pilot project, and this is something that really scares me sometimes. It's not always a blessing, and some features of it is like one size fits all. So I'm just waiting to see like some criticism coming forward. Just wanted to ask how we should see that. How can we move forward with a pilot project that can be used as like a good assessment tool, but there's going to be some deficiencies that we will just gradually find out. Because like as the first presenter just pointed out, when the forms are changing, there are some problems with just asking all the organizations using new forms. And like, even, is that the best idea? Because like, and how often can we change the forms? How can we just treat the pilot projects? How can we just, should we focus on changing some parts that are not working? Should we just return to the previous one? Like, how can we treat, how can we just go through this transition to a like permanent, possible, like positive change? Thank you very much.
Yeah, no, that's a good question. I think with the VI SPID-AT, there was many things that we wanted to change, and like a good example is during COVID-19, you know, we needed to respond to that like everyone else did, right? But we just couldn't because it was that proprietary tool and it was owned by the organization, right? So I think by moving to creating your own tool as a community, it gives you the freedom to respond to the needs of the community, and not to say to change everything. But if something is not working, like really not working, I think it really gives you that freedom to be able to truly collaborate and respond with the community. And our plan is to do that get feedback on an annual basis around changing the tool if needed. And then, so it's not like that constantly changing. And then there's things around data consistency as well that you have to take into consideration. So, you know, we're implementing in the new year, so I think it's going to be interesting to see how that process works. But I do, one of the, you know, guiding principles we have is that community collaboration piece. So we think that this is the right way to go to really in that spirit of collaboration. But there is, I get your concerns there around as well.
Can I just add something? I know it's not what we presented on, but I just thought we would add a suggestion is something that you could do that is a short burst, a PDSA. So doing a plan, do, study, act with with that particular, instead of a pilot initially, because the pilot means you run it as is and then get feedback after. But if you're concerned about whether or not the tool or the process is going to be good for your community, you could do a PDSA, which would be a short burst. So usually they're about 3 months, 1 month to 3 months, and where you plan to use the tool as it is and get feedback within that 3 months. So every time there is somebody that has used the tool, you get their feedback in that moment. And then you study that feedback at the end of the PDSA. And then the PDSA can then provide you with the tools to run the pilot. So you'll get that short burst of information, but it's information that you can use to change, make facilitated changes before you run the pilot, because usually pilots take up more resources, they're longer term, and you really don't make changes in a pilot until the end, where you're getting all the information and then making the change. And that sounds to me like your concern is that you're going to pilot it, but it's not going to be effective, it's not going to meet community needs, but you're still going to have to use it. So I would say if you are open to it, run a PDSA, get the feedback quickly from people using it, and then use that feedback to run the pilot. That's just a suggestion.
Any more questions?
Hi, thank you so much. That was really great. And so I have a question that sort of connects to the first and the last presentation. My name's Erin. I work at a health unit in Northern Ontario. And our organization doesn't participate in the HIFIS data collection, but we're closely connected with other community partners and understand the data collection and the process and use that information quite a bit in our community just to inform different things. And understanding sort of the difference between, say, HIFIS and PIT count data, and differences between those two data sets and why there's, you know, strengths to both of those. Internally, we're looking at implementing a socio-demographic data collection project because we feel like we don't have good data on our client demographic. We have a number of client-facing programs that are meant to reach lower income folks experiencing homelessness. But I have some pretty significant concerns from an ethical perspective with regards to how the information is going to be utilized. And I don't think we have good clarity on that other than like nice to know. And I think understanding some of the tensions around in the community around getting staff buy-in to ask the HIFIS questions and looking at data gaps we have as a result, and then how there's a disconnect between the HIFIS data and the PIT count data because the PIT count questions are asked much more intentionally and trying to be very comprehensive. So I've heard about these tensions in the community around, Indigenous status, for example, is a big gap in our HIFIS data. Staff just aren't comfortable asking, frankly, that question, and other ones as well. So I just wondered, I think for the third group, if the SHIP group, if you have any insight around how the data you collect has been meaningfully utilized. I liked how you shared the one example about you can connect it to training needs to sort of, like if the question is maybe not being asked right or staff aren't comfortable asking it for some reason. But if you have any other advice or ways in which that you meaningfully use that data. And my background technically is in food insecurity and nutrition. So like one ethical consideration that comes up a lot in healthcare and food insecurity and screening is sort of like, yeah, again, the nice to know, but how are we helping that person who then screens positive for food insecurity? Like we're referring them to a food bank and we know that doesn't really help, but there's nothing else we can really do, or maybe try to connect them with some income supports, but that typically isn't done in a comprehensive way. So yeah, that's sort of in a nutshell. I hope that's clear, but any comments you have on that piece, either for anybody of the panelists? Thank you.
I have one, and it's because you're health. So I'll give you a health example. One of the things that we do with our data, and it's also, I think it's really important to also state that this data collection that we showed you in our dashboard, that we're at 92.5% alignment, that's as a result of many years of building a data equity culture, of training over and over, of ensuring. So we at SHIP, data equity training is mandatory. It's required training for everyone, not just frontline staff. It is required for all direct service staff, but we offer it to anybody and everybody that would like to take the training. Because as a health service provider, what we use our data for is health equity, building health equity into practice. So that's my example to you of, the training piece is important to get, and I don't use the word buy-in because it's our job. It's our job. So I don't think we need to train staff to buy in. We train staff to build capacity, to understand what their actual value is, what the value of collecting this information is. So that training is really important. But on top of that, there has to be an action associated with the demographic data. So what we do at SHIP is we do the health equity impact assessment. And that socio-demographic data, which is the social determinants of health, is used within the health equity assessment planning. And that assessment is where we see and we can analyze the data to kind of look at the HIA, the health equity impact assessment, and it helps us within that process. We use the HIA then to develop health equity plans for each program, and that's where you see the action. And it's all linked back to the socio-demographic data, MHA PDS, that we collect. So when you develop a process like that, where there's an actionable outcome that staff and community can see, that's what you explain. So we can say to clients as we're having these conversations about their information, this is what we do with it. We're going to develop health equity plans. We're going to see what the impact is. We're going to evaluate whether or not what we put in place is going to be effective. So for example, and it could be something simple, very simple things, that if we collect information about food insecurity and we see that 33% of the clients in our service that are with us in service experience food insecurity, and then we use that information to develop a proposal to get funding so we can run internally programs that provide opportunities for food insecurity rather than referring people to food banks. So it's things like that where you can take the information and action it into something concrete and then go back to clients and say, this is what your information, this is the value of what you told us. So just some example.
Oh, okay, no, it's fine. Sorry, I will also just kind of mirror what Shireen just said in terms of as we're rolling out this new intake, one of my main goals is kind of engaging with the community in terms of how to do this, put it into HIFIS. The intake itself that we have just it's more of an update than like, significant change. So they are more or less already comfortable with it. But in terms of kind of getting that, buy-in just sounds not quite right. I didn't realize that until you just said it. I'm like, I don't like it either. But kind of getting that teamwork, I suppose, together in terms of having them understand, why am I engaging with this question with this client? What is this information I am collecting from this person going to do for them? How is this going to help them as they move through this, you know, extremely complicated system? That I found in terms of like training and helping staff understand, like, yes, it is a long process and we're asking you to do kind of like a lot of stuff, but at the end of the day, how is all of this information that you have collected from this person going to be used to get them to where they need to be? And that I found has been extremely helpful, and kind of especially people with, you know, hesitancies using HIFIS for like a variety of reasons, fair enough. And also just, you know, tech stuff in general, having that understanding of, this is a tool that I can use to ensure that this person is on the correct path to the resources they need, and kind of eventually, hopefully, you know, down the line, see that fulfilled in terms of like, this person is housed, this person ends up where they need to be. That has been exceptionally crucial. So just wanted to, reiterate that.
Hi, I'm going to be working on a homelessness count in some small northern communities, and have been told that asking questions about gender could be particularly sensitive in those communities. And so I know you mentioned a little bit about only gathering the information if they're comfortable, and then I think a couple of you suggested like some alternative ways to maybe ask questions so that they are more comfortable. Wondered if you had any suggestions on the gender piece, because I think when we've done it before, sometimes people, even just asking the question seems like it makes people uncomfortable, or saying, like, why would you suggest that it would be anything other than man or woman or something like that in some of those communities? Wondered if you had any thoughts on that.
I always have thoughts on this stuff. It's kind of like a little bit my job. So, one of the things, and this is an issue for us too in our organization, and I think that, you know, one of the ways in which we've sort of had conversations about this, we happen to have ERGs, employee resource groups at the organization, and we have a proud ERG for 2S LGBTQ+, and also for gender identity. And that group, they are the experts. This is their lived experience. And so when we go to them, they suggested, and this is what they do now, is they go to teams. They've made the offer to our teams who do have some discomfort asking about gender because of the responses that they're getting from clients. They have gone to team meetings and offered their support about how opening up that space, how you can open up that space for clients. The other piece that I talk to, because a lot of staff will come to me directly and say, listen, like, I don't want to have this conversation. And a lot of the times when I dive deeper, it's more than just being uncomfortable with asking about gender identity. It's also about cultural responsivity. Different cultures view gender differently. And so people can be uncomfortable or client with the responses that they're getting from people. It's not that they're uncomfortable with asking or talking about it, it's they're uncomfortable with when they get a response that they don't know what to do with. And that response would be something like, you know, I'm Jamaican. I'll just use myself as an example. I'm Jamaican. I can't go to my community and say that, you know, are you she, her, or they? I can't. I know that. That's not something that I would open a conversation up with, because I know my culture and I know those pieces about it. So I would have the conversation differently based on my understanding of that culture. And granted, we don't know every culture every way, but that's why we're also embarking on cultural responsivity training with the organization as well. Because it isn't about knowing every culture and knowing all the nuances of every experience. It's about understanding that you just open space, and then you go off of the person's response, their comfort level, right? So if you say to somebody, you know, how do you identify? And they look at you and say, don't ask me questions like that. Then you say, I'm sorry, let's talk about something else now. Or you say, you know, how would you prefer to have this conversation? Do you want to talk about it a different way? Is there another way that you're comfortable talking about? Because I really want to get to know you. And that's an important part of you. If you're comfortable talking about it differently, you just let me know how that is, right? Like, that's, I think, and it's unfortunate, like, that I think we need training to do that, but we do, right? Like, we do, because we get stuck in how we've been taught to do these things. So I would suggest, like, looking into things like that, like, and I would refrain from cultural competency training. I think if we're going to do anything, it's about cultural safety. How do you keep people safe, but open space for them to talk about themselves and the nuances about themselves, rather than looking and trying to be competent about people's culture? Because I don't need anybody to be competent about who I am. I'd rather that you create safety for me. So that would be my suggestion.
Thanks, Shireen. So we're at 3:15, so out of respect for everyone's time, I just wanted to thank everyone again for attending, and thank you to all of our panelists who took the time to do the presentations and came today to give us all the benefits of their experience. So.
We'll be here for a couple minutes if you have questions.